Hello, and welcome to the ALCSI podcast, where we share the stories of lung cancer patients and their caregivers, as well as the work of doctors and researchers in the field. Today, we have the great honor and privilege of having Daniel West with us. Daniel is a survivor and dedicated lung cancer patient advocate to increasing awareness, supporting patients, and reducing the societal stigma associated with lung cancer. His journey began in October 2022 when two suspicious nodules were identified in his lung during a heart scan and later confirmed to be stage 2B non-small cell lung cancer with an EGFR positive biomarker. He received treatment, and his scans currently show no evidence of active disease.
He has been actively involved with the Lungevity Foundation, where he has attended their annual Hope Summit and contributed to a weekly support group with other survivors. Most recently, he has joined the MD Anderson Patient and Family Advocacy Program, whose purpose is to improve the patient and family experience at MD Anderson. This past year, he has spoken at national conferences, contributed to the 2024 AACR Cancer Disparities Progress Report, participated in several webinars, and met with legislators to advocate for more lung cancer funding.
Daniel, we are so honored to have you on our podcast today, so thank you so much for your time. And to introduce the moderators today, my name is Priyanka Senthil.
I'm Jacob Rashad.
My name is Pranav Mandian.
And I'm Sam Schwartz, and we are the American Lung Cancer Screening Initiative, a national 501c3 nonprofit working to raise awareness of lung cancer and lung cancer screening. So to get us started, Daniel, can you please tell us a little bit about yourself?
Sure. Thanks, Sam. And thanks first for just having me on today. I'm really happy to be here and talk with you guys and ladies. So my name's Daniel. I'm 54 years old. I live here in Houston, Texas, just down the street from Rice. Born in San Antonio, raised in Houston, and live here with my husband John in Montrose. So we've been together 21 years. In Montrose for about 15, so we love being here. I graduated from A&M with a bachelor's in economics in 92, and then I got my MBA from the University of St. Thomas here in Houston while I was working in 2003, I guess. So as far as work, I work for a financial management firm. I've been here for 30 years. Actually, it was my first job. Back in May of 94, I worked for AIM, and I still work for the same firm now. The name is Invesco. I left for a while and came back, but I've worked in a number of divisions within the company, sales, operations, investments, and now I'm in more of an administrative support role for our equity investment professionals here in Houston and New York. And outside of work, I love reading and traveling. We do a lot of traveling. I think our favorite thing to do is cruising. And more recently, the last couple of years since my cancer diagnosis, both John and I have become more active in lung cancer advocacy. So as this team kind of alluded to some of the things I've participated in, I've been real active with Lungevity and have attended their Hope Summit and participate in their support group, which has been fantastic. And I would definitely recommend that for anyone that is going through this diagnosis to have a support group like this. So that's kind of a little bit about me.
Yeah, so in our initial meeting, you talk about how your lung cancer diagnosis came about in sort of an unexpected way. Can you just tell us a little bit about the timeline of your diagnosis, how you found out, what led up to the screening, just go through that.
Sure. So in my family, we have a history of heart disease. So my grandfather died of lung cancer, and my mother actually also passed away from breast cancer, but the most concerning thing for me at the time was the heart disease. And so I had access to some screening through my employer. It was affordable screening for heart scans. So I went in to do that and came through the heart scan, and they said, your heart looks fine, but we have found these two concerning nodules in your lung, and we recommend further testing. So that was surprising for me. So that was in October of 2022. And so we went to my primary care physician, and then we were referred to a thoracic surgeon who performed a bronchoscopy. So they took a biopsy of the suspicious nodule, and then about a week later is when I got the diagnosis. So that was in December of stage. At the time, it was stage 1 because they just didn't know if there was spread or anything like that. And then they just scheduled me to meet with the surgical team. So we were really surprised about that. And I guess you're going to ask me about that too, but so.
Yeah, of course. And like before receiving your treatment, I saw that you saw a second opinion. And what do you think is the importance of getting a second opinion or another opinion before going through with treatment, especially for cancer?
For sure. I think it's like critically important. For me, I wanted a second opinion because it was such a serious diagnosis and serious uh, treatment plan. And also, I was lucky in a way because living here in Houston, we have such a wonderful, large medical community. And I had the option of getting a second opinion. And in fact, and being from the South, kind of this, I think of this, is it polite really to, or am I doubting the medical qualifications of my physician if I say I want a second opinion? And absolutely not. It's, in fact, the first physician that I saw, he said, if you do ever meet with a doctor and ask, say that you want to get a second opinion and that doctor doesn't want you to get a second opinion, he said that is a bad thing because, really you should always be an advocate for your own health and be comfortable with, your plan of treatment. So for me, and I think for most people, it definitely is important. That's very important. Yes.
Absolutely. And I think you really highlight on some of the things that we've talked about in other podcasts with other lung cancer patients who've had a similar experience where they sought out a second opinion, and it was really critically important in their choice of treatment because, for example, one of our guests talked about how the doctor that she sought out a second opinion knew a clinical trial that she wasn't made aware of prior and ultimately chose to participate in that clinical trial. And
Yeah,
so if she hadn't gotten that second opinion, she probably would have opted for a very different course of treatment and ultimately was very happy with the outcomes of the clinical trial. So thank you for sharing and for really encouraging people to be their own advocate.
absolutely.
And related to that, I wanted to ask if you'd be willing to share a little bit more about what your treatment plan was and what that whole experience was like. You mentioned that initially you thought you had stage 1 lung cancer, but we now know, as we shared, that it was stage 2B. And so if you could also kind of walk us through that journey.
Okay. Yeah. So when I met with the first doctor, we only talked about the surgical piece of the treatment plan, which was also why I was concerned and wanted to seek a second opinion because I felt like I wanted a more holistic, to talk to an oncologist as well as a surgeon, and get a more full view of my treatment plan. And so when I sought the second opinion, I actually went to MD Anderson, and I was surprised when I was there because their approach was the same. So the plan was to do a video. It's called a VATS procedure, which is a video assisted thoracoscopic surgery. I wrote that down. It's minimally invasive. They kind of go through the side of your chest, and they were going to remove the lobe of my lung that had the suspicion or the cancerous nodule in it. Because I guess in early stage, it's, they want to try to surgically like remove that as much as they can. And so the plan was for surgery. But what the interesting thing when I was at MD Anderson was they also And then they would test, and once they were in there doing the surgery, they would also test my lymph nodes to see if there had been any spread. And we found out there was. So that's what it was. It had spread to some lymph nodes around the nodule, and as a result, then that's when we decided to move forward with a chemo treatment plan. So I did chemotherapy, several rounds of chemotherapy, and then back to the great reason I got a second opinion. What we also found out with my testing, or with my testing, was that I was EGFR positive. So I had this gene mutation that causes the lung cancer to spread, and there was also a treatment plan associated with that. So the treatment plan was to do the chemotherapy and then go on to Tagrisso is the name of the drug that I'm taking, but it's a TKI drug that I'll be on for 3 years. So, and just, we were, like I mentioned earlier, we were shocked. I have some risk factors. I smoked as a young person, but I'd quit more than 16 years before my diagnosis. So kind of came out of left field a little bit. And, what we did, how did I, what was going through my mind? I think we just wanted to tackle it. We were happy that we got it early. I felt very thankful that, through this screening, I was able to find this, because with lung cancer, often, because I had no symptoms, obviously, often with lung cancer, when you have symptoms, it's already spread, or it could be stage 4, and which is much more hard to treat at that point. So we were just in it, and we were, full speed ahead and on board with the doctors too there at MD Anderson.
Yeah, thank you for sharing. And it's really wonderful to hear your story, because it's great to hear how fortunate you are to have received that heart scan and for that scan to have picked up those nodules. But I wanted to really emphasize on something that you mentioned, which was that you had quit smoking more than 15 years ago. And for anyone who's listening who might not be familiar with the current lung cancer screening guidelines, the USPSTF, or the United States Preventive Services Task Force, which sets out these guidelines for cancer screenings, including lung cancer, currently recommends annual screening for individuals who are aged 50 to 80, who have a 20-pack-year smoking history or more, and who either currently smoke or have quit in the past 15 years. And so under these guidelines, Daniel, we wouldn't have even been eligible for a lung cancer screening. And something that we discuss really frequently in our other podcasts is the importance of recognizing that there are inadequacies with the lung cancer screening guidelines in missing individuals who might be at high risk for lung cancer, but don't have quite that level of a smoking history or recent smoking history as required. So I definitely think that a lot of research is being done in the field using lung cancer risk prediction models that take into account other risk factors for lung cancer that I think are going to be really important, as well as some really interesting AI and machine learning models such as Sybil, which we're going to be talking with Dr. Alicia Sequist, who's leading that study in the next couple of weeks. But for anyone who's listening who is worried that they might be at high risk for lung cancer, we just really encourage them to talk to their primary care doctor about lung cancer screening.
So just to segue a little bit, so you talked about some of your treatment. You said you went through chemo, you're on Tagrisso. I think a lot of times when we think about cancer treatment, a lot of things that we overlook, or at least as people who are not experiencing the lung cancer, is that we don't think about the complications that are associated with the treatment, not just the symptoms of the disease. We were talking on another podcast the other day, someone mentioned that even something as diarrhea can be debilitating. And it's something that we don't always think about if you're not experiencing it yourself. So I was just curious if you're willing to share Were there any complications that you experienced from your treatment?
Yeah, yeah, definitely. Just that example you said, if you're, I'm employed. So if I'm at the office, if that came up, definitely can interfere with work. So, and, if I'm not working from home. So yeah, those things kind of come about. But so for me, the main thing I had was uh, I had a blood clot in my leg that developed kind of what the doctors kind of described. It's like you have the trifecta. You're on blood cancer, you've had chemotherapy, you have cancer, and you're just less active because you're going through treatment. So those three things are not they're a good recipe for kind of blood clotting. So I had a blood clot in my leg, and went to the emergency room and went on a blood thinner. But then even more concerning is several months later, I took the blood thinner for about 6 months and then went off, but then started having some breathing problems. We were about to go out of town and actually on a plane. And my husband said, "You need to get that checked out with your care team and see what's going on." Because some of the side effects from Tagrisso, these TKIs, can be like inflamed lungs or something like that. So we went in and it turned out that the blood clot had spread to my lungs. So that was really scary because that also could have done, it didn't, but it could have done, damage to my heart. Um, so I was again just so thankful that had access to go to the emergency room and with this fantastic team of doctors. And I've had, as far as other symptoms of, I had some inconveniences. Tagrisso it's kind of, it dries anything that's associated with like being dehydrated is kind of, hair, lose some, some hair loss, brittle skin problems, things like that. And then, stomach things like that at first, when you first start getting used to some of these medicines, those can be, they have a lot of, other medicines to help with those side effects too, though now. So that's a good thing.
Just to,
But yeah,
oh, sorry.
no, go ahead.
Just to follow up from that. So you talked about some of the complications. Did any of the symptoms you experienced from the drugs you were taking or the treatments, did it ever influence if you wanted to stop treatment, if you wanted to change your treatment, if you wanted to change your course? Did it ever reach that point?
Yeah. No, I still, I I still feel like obviously it's better than the alternative, which would be to have the cancer returned. So, managing those symptoms certainly is the choice that I would make. Now, I have thought at the end, I mean, being, more tired and kind of feeling a little run down, which kind of you're in a constant state when you're on one of these TKIs. I'd like to, the recommended treatment is 3 years. So after that, yeah, I'd like to go off of it. If we have no evidence of disease and the doctor is okay with that, I'd like to go off of that and see how things work. But for now, I feel like, the treatment is still worth the side effects or the outcome of not having, hopefully not having a recurrence is better than just dealing with the side effects. So.
Yeah. Well, thank you for sharing some of those issues with us. We really appreciate that.
Sure.
And so to transition a little bit, we mentioned earlier that you had contributed to the 2024 AACR Cancer Disparities Progress Report.
Yeah.
For anyone who doesn't know, could you please just tell us what the Cancer Disparities Report is and sort of how your advocacy work fits in with that?
Sure. And I'm going to read some notes on this because I wanted to make sure I capture that. But so the American Association for Cancer Research is the AACR, and they're the group that produces that report, and they're kind of the uh, largest organization for cancer research, and they have close to 58K members in 141 countries. And their mission is to prevent and cure cancer through any cancer, not just lung cancer, but prevent and cure cancer through research, education, communication, collaboration, science, policy, and advocacy and funding for cancer research. So The report that I participated in, so within treatment of cancer, there are noted like health disparities where, because of someone's socioeconomic status or their access to healthcare, someone that lives out in the country or versus someone in an urban setting. So their healthcare access, maybe their mental health or modifiable risk factors. So if that would be like, smoking, that would be a modifiable risk factor that might be different in different groups, or even biological factors. So, and the report highlights area of progress in understanding and reducing cancer disparities. So, an example may be, let me write that. Yeah. So this is kind of out of this progress report this year that I thought was very interesting. So one striking example, although the overall cancer incidence rates among Black and American Indians people are lower compared to the white population, Black and Indigenous individuals have the highest overall cancer death rates of all U.S. or racial ethnic groups. So that's kind of an example of um, uh, a disparity. And so this report, there were like, I think 8 or 9 of us that were kind of representing different communities. So I was kind of I'm a member of the sexual and gender minority community. And so, which is one of the targeted communities that they review. And I think it's less, it's less is understood about the sexual and gender minority populations because there are not the tools to poll someone to see if you're a part of that community when you're going through your cancer treatment. So there's less understanding around those disparities, but they're trying to make progress in finding out that and addressing those concerns.
Yeah, it's amazing. And like based on your experience with the AACR and also your personal experience as well, how important would you say it is for physicians to be trained to be made aware of all these disparities, in order to provide the best care for their patients?
Sure, I think it's super important. For me, and this goes to kind of back to when we got a second opinion and talked with our doctor. But John and my husband and I, we're like kind of, that's our family. We're the family that's kind of we make a decision as a family. So we felt like we wanted to, and it was important for us to have trust in our doctor and for them to be comfortable with us and understand our perspective that, we were a normal couple trying to make the best decision for, our health and my family. So that was very important. So, empathy and understanding your patients is great and appreciated.
Yeah,
Feeling welcome,
definitely. And I think we touched upon a couple of different examples throughout the podcast, but you talked about, you encouraged patients to seek a second opinion and to really advocate for themselves in the process of figuring out what is the best treatment plan for them. In addition to that, are there other examples or recommendations that you can provide for our listeners on how patients can really advocate for themselves throughout this entire journey?
Sure. I mean, for me, it was really important to be around other survivors of the kind of cancer that I had. So with me, I became active, and I was just Googling the stuff on the internet, where to go, because at MD Anderson, they have some programs, but it's just a little bit it's a little bit different. It's siloed. And I just needed to kind of look to see what resources were out there. And, finding Lungevity and going to this Hope Summit was really amazing because it was very educational. I was going through chemo when we went. And it was on like one of my down weeks. So we went there, met a lot of people that are in the same situation, and were there to answer questions, and be a support. And then I've connected with that community after. So you know, I feel like knowledge is power. So, that's kind of cliche, but, um, you know, being on these calls, I go to a weekly call where kind of everyone checks in, and we have an expert that comes in every month and talks about different cancer topics related for lung cancer survivors, health and nutrition or cooking or, managing side effects or, talking about your diagnosis with someone or, whatever the topic may be. We're all just kind of reinforced that I wasn't in it alone and that, my treatment and, it's partly on my responsibility to ask the questions and, you know, uh, try to make the best decision that I can. So I think, and like what you guys are doing, the lung cancer walk this weekend and making people aware of, the issues around lung cancer screening, if you have risk factors to get tested, if you, or talk to your doctor, I think that's super important and it's empowering. So, you know, kudos to you guys.
Thank you so much for taking a part of this walk. We are having a walk at Rice University Stadium on this Saturday to raise awareness about lung cancer and lung cancer screening among both the Rice community, other students, and also just a broader Houston community of survivors, oncologists, and everyone in Houston to participate. So we're really excited for the walk coming up, and we're really glad that you're able to participate in this walk as well.
Absolutely. Looking forward to it.
So to kind of wrap us up, and you did touch on this a little bit, you said that knowledge is power, and I think it perfectly sums up the importance of understanding lung cancer and lung cancer screening. Unlike a lot of the other cancers that are screened, breast cancer, prostate cancer, that have really higher rates of screening, lung cancer is the leading cause of cancer deaths in the United States. Yet it is one of the lowest screened cancers. And a big reason for that is because there's a lack of knowledge of lung cancer. There's a lack of knowledge of the eligibility of lung cancer. The eligibility itself for lung cancer screening can be quite rigid. So from your perspective and your work and your experiences, can you tell us what you think that we can do to increase access to early detection and increase affordable screening?
Sure. Okay, well, I think really what you guys are doing and making people aware is probably the most important thing. The visibility and information around lung cancer and risk factors and available screening is super important. And if you have risk factors, to get tested. So there's no shame in, I'm a former, or I have a smoking history, and but everyone deserves access to health care regardless of your risk factors. So it's important to get tested and catch it early if it does touch you. So.
Yeah, thank you so much for that. And it really has been a pleasure and honor speaking with you, Daniel, and learning from the wealth of knowledge and experience that you have as a lung cancer survivor and as a patient advocate. And we really appreciate all the work that you're doing and your perspective. And thank you for our listeners for joining us on this episode of the ALCSI podcast. We hope you enjoyed it. And please keep an eye out for our upcoming podcasts and events, which will be posted on our website, www.alcsI.org. Thank you, and everyone have a great day.